We had patients who had a laparoscopic elective and non-elective cholecystectomy and appendectomy were randomized in a 2-to-1 fashion to a virtual visit versus an in-person visit. And we tracked the time that the patient spent in both of those visits. So if the patient came for a virtual visit, we looked at the time they logged into the app, the amount of time they spent checking in, how long they waited, and then the amount of time they actually spent with their provider. When patients came in for an in-person visit, similarly, it was when did they walk in the front door and register, how long were they in the waiting room, how long did they wait in the exam room, how long were they with the provider, and then how long did it take them to get discharged after the provider left the room? Because we know each of those steps actually contributes to the patient's time commitment for the visit. And so other studies have looked at the total visit time. They've not been able to break down the specific amount of time that the patient spent with a provider. And we wanted to know if that was the same or different between the virtual visit and the in-person. You could hypothesize both ways, that it would be shorter in the virtual visit because there wasn't that connection and patients would sort of just get on, say, hi, I'm fine, and leave. You can also imagine that it's longer because if patients mentally carve out 30 minutes or an hour for a medical office visit and they don't spend that time parking, walking, waiting, that they might be interested in spending more time talking with the provider and asking questions. So we really wanted to get down into the nitty-gritty of how much face time was spent between the surgical team member and the patient. So actually the amount of time that the patient spent with the surgical team member was the same in both groups. It wasn't shorter because there wasn't a connection, and it wasn't longer because it was more convenient and efficient. It was just the same amount of time. It seems that in both groups, patients ended up spending the same amount of time with providers talking about their postoperative recovery and health maintenance. There was, not surprisingly, a much longer amount of time spent waiting for the in-person visits. Even in the virtual visits, the amount of time that the patient spent not with the provider, so checking in and waiting, was about 55%. So because the virtual visits have all the same regulations that an in-person visit does, the patient spends time with our CMAs reviewing medications, confirming that they're in a state where they're able to do a virtual visit, confirming insurance status, and all those sorts of things. So even if you take out the waiting room and patient flow within a clinic, patients are still spending about 50% of their time just doing the logistics of check-in. But there was much, much, much less time spent waiting, about 80% less time spent for the total visit in the virtual visit.